Hello, Emma. Can you explain the skeletal structure of the thorax?
Absolutely. The thoracic skeleton is composed of the thoracic vertebrae, ribs, and sternum. This forms the thoracic cage, or thorax.
What are the main parts of the thorax?
The thorax includes the thoracic cavity, or cavitas thoracis, the superior thoracic aperture, or apertura thoracis superior, which is the upper opening of the thoracic cavity, and the inferior thoracic aperture, or apertura thoracis inferior, which is the large lower opening. The spaces between the ribs are known as intercostal spaces or spatia intercostalia.
Can you tell me more about the ribs?
Certainly. Ribs, or costae, are dorsally attached to the thoracic vertebrae. They have a thin layer of compact bone on the surface and spongy bone inside. Ribs are curved and categorized into 3 types. 1. True ribs, costae vari. These are the first 7 pairs of ribs, and they are connected to the sternum by costal cartilage. 2. False ribs, costae spurii. These are the next 3 pairs of ribs, and they are connected ventrally to the cartilage of the preceding rib. 3. Floating ribs, costae liberi or fluctuants. These are the last 2 pairs of ribs, lacking a cartilaginous part and embedded within the abdominal wall muscles.
What are the main features of a typical rib?
A typical rib has several key features. 1. Costa, rib, a long, slender, and curved bone. 2. Cartilagio costalis *, the costal cartilage that firmly attaches the rib to the sternum or the preceding rib. 3. Caput costae *, the head of the rib that articulates with the vertebral body. 4. Facies articularis capitis costae *, the articular surface on the head of the rib. 5. Crista capitis costae *, the crest that divides the rib into 2 surfaces. 6. Column costae *, the neck of the rib, separating the head from the rib's body. 7. Tuberculum costae *, the tubercle that articulates with the transverse process of the vertebra. 8. Corpus costae *, the body of the rib. 9. Crista costae *, the sharp lower edge of the rib. 10. Sulcus costae *, the groove along the rib. 11. Angulus costae *, the area of the rib where it curves more sharply. 12. Facies articularis tuberculi costae *, the articular surface on the rib's tubercle.
What are some specifics about the first and second ribs?
The first rib, or costa prima, is broader, shorter, and has a single curve with a prominent tubercle. It also features the sulcus arteriae subclavii, which is a groove for the subclavian artery. The second rib, or costa secunda, is longer and includes the tuberositas musculi serrati anterioris, a rough area for the attachment of the serratus anterior muscle.
What about the sternum?
The sternum, or breastbone, is composed of 3 parts. 1. Manubrium sterni *, the broadest part of the sternum, featuring the incisura jugularis, a notch that borders the jugular fossa, and the paired incisura clavicularis, concave articular surfaces for the clavicles. 2. Corpus sterni *, the body of the sternum, which connects to the manubrium through cartilage or synostosis. It has incisurae costalas, notches on its sides for rib attachment. 3. Processus xiphoideus *, the xiphoid process, which is the cartilaginous or ossified lower part of the sternum.
How do the ribs articulate with the sternum?
The ribs connect to the sternum through the articulatio capitis costae, where the head of the rib fits into the costal notches, or incisurae costalas, of the sternum. This articulation allows for the movement and flexibility necessary for respiration.
Thank you for listening. If our podcast has been valuable to you, we would greatly appreciate it if you could leave us a 5-star rating and write a review on Spotify and Apple Podcasts, or subscribe, like, and share on our YouTube channel. Your support helps us greatly with discoverability. We hope to see you soon.